All right, well, we're going to go ahead and get started in the interest of time, but I'll be keeping an eye out and letting more folks in as they join us. So welcome again to everyone. Thank you so much for joining us for our AmeriCorps Member Assistance Program informational member orientation. So this webinar is an opportunity for AmeriCorps members and others that may have access to the Member Assistance Program to learn more about the benefits available through the Member Assistance Program, how to access those benefits, and then also just provide an opportunity for questions. So if you have questions, this is a great time to ask them about the Member Assistance Program, how you can access services, and just anything that you may have as it relates to this program. If you haven't done so already, I just want to invite folks to continue to share in the chat box your name, your organization or program, and where you're joining us from. So it's always great to see where everyone is logging in from. So I see folks from South Carolina, Texas, New Jersey, Minnesota, Arkansas, New York. So we have quite the diversity of attendance today. So just really excited to have you with us to talk a little bit about our Member Assistance Program. As you know, I am recording, and that's so that folks that weren't able to join us today can have access to this information, or if you're interested, you can access and review the recording on your own time. So we will send out the recording to all registrants. We'll also share the recording with all of our program contacts for the Member Assistance Program. So for those that weren't able to attend this orientation or the two previous orientations we've held throughout the past couple of months, that they'll be able to watch the recording on their own time. I do encourage you to use the chat box if you have any questions throughout, or you can also use the raise your hand reaction button on your control panel if you want to raise your hand, and I can let you know that you can speak over audio if you want to unmute yourself. So for those of you that are not familiar with America's Service Commissions, we are the National Association of the 52 State Service Commissions, which administer AmeriCorps state and national funding. Right now, over 75% of all AmeriCorps state and national funding is administered by state service commissions. And we at America's Service Commissions are their association. My name is Rachel Bruns. My pronouns are she, her, and I'm the Chief Engagement Officer for America's Service Commissions. I lead our training and technical assistance and capacity building efforts for the State Service Commission Network. What we are, as I mentioned, here to talk about today is specifically the Member Assistance Program, which is a unique program that we started offering to the State Service Commission and AmeriCorps Program Network about 5 years ago. So it's still relatively new. And really it came about as a result of having lots of different conversations with state commissions and their programs, that they were really having a hard time finding affordable and accessible services, specifically mental health counseling services that could be a resource for AmeriCorps members in their respective states and territories. So out of hearing about that consistent need throughout the country, we developed what is now known as the Member Assistance Program, which we also refer to as MAP. So for all of you on the call today, you are here because your AmeriCorps program has enrolled in MAP through America's Service Commissions, and you all have access to the benefits that I'll be describing throughout the webinar today. So what is the AmeriCorps Member Assistance Program, or MAP? The primary benefit and really the focus of MAP is to offer a free and 24/7 unlimited telephonic mental health counseling service for AmeriCorps members. So most of the programs that enroll in MAP are enrolling for their AmeriCorps members. Some also do enroll and provide coverage for their employees as well. So that may apply to some of you, but that is a very small portion of who has access to this program. So vast majority accessing this program are AmeriCorps members. So really the core benefit is this 24/7 telephonic mental health counseling. That's available to you as well as your household members. So you can call the 1-800 number, which is available and hopefully you all have access to, but I'll go over that briefly as well. You can call that 1-800 number any time of day and talk with a licensed mental health counselor about any issue that you want to talk about. So we really encourage use of this line and the 1-800 number and to access the mental health counseling really for any issue, or just if you want to talk with someone about whatever topic you're interested in engaging with someone on. So this is a free service for programs that, so free for the members because your program's paying for it. It is confidential, so no one knows that you're calling the service, and it is voluntary. So of course, no one's required to call the service either. There's also translation services available in up to 140 languages. And we partner with an organization called All One Health. All One Health is the provider of all of these services. So the 24/7 mental health counseling telephonically is the main kind of benefit. You can access the mental health counseling and some of the other benefits that I'm going to mention via the 1-800 number. There's also a app and a website that includes chat and video. However, those are only accessible during business hours. So I share that mostly just to make sure folks know that if you are needing that in the moment support, we're always going to encourage you to call the 1-800 number because that's where you're going to be able to connect with someone immediately and in that moment. If you are interested in using chat or video for counseling, you can access that during business hours, or they may kind of say like, we'll work to schedule you with someone. That's not, unfortunately, at the point where it can meet demand for that in the moment support. So it's available, but just know that if you're looking for that in the moment support, say you're calling at like 9 o'clock at night, it's going to be over the 1-800 telephonic number. And again, this is for like any kind of topic or issue. This could be talking about a family conflict. It could be that you're dealing with some stress or anxiety. It could be specific to your service that you were wanting to talk to somebody. So we encourage members to call for any reason. These are some of the common reasons that we hear that folks do call and seek support through the telephonic mental health counseling. I see the question about what the 1-800 number is. So I do have it on a slide. It's coming soon. I will make sure you all have that. And hopefully you also have received flyers and materials from your program director with that information as well. So if not, we can remind program directors to make sure you have that accessible as well. There is like an additional benefit that's available that programs can enroll in called face-to-face counseling, and so that's for our premium level. So those are programs that are paying a little bit higher fee. So this is something to confirm with your program. If you have access to face-to-face counseling, then that is something that is made available to those participating programs and their members. Essentially, if you have access to this and you would like to speak with a counselor in a face-to-face environment, basically you would call the 1-800 number and let them know that you're interested in accessing face-to-face counseling. They will then take some information from you on where you're located, what type of support you're looking for, what your availability is, and then they will follow up with you to schedule that in-person session. That could take anywhere from 2 to 4 weeks to schedule out as they're looking for appropriate providers in your area. And again, this is something that you would want to confirm with your program, or you can reach out to us at American Service Commissions to see if this benefit is available to you. With the mental health counseling, both the face-to-face and then also the telephonic counseling. Something I always like to let people know that when you call the 1-800 number, there is an intake process. So before you're speaking to someone, you're going to first go through an intake process where they're going to collect some information from you and get you then routed to the best person to speak to based on why you're calling. So when you do call, you want to be prepared to provide them with the name of your program or organization. So basically, when your organization enrolled in the member assistance program, they provided their organization name and AmeriCorps program name. So you'll want to be prepared to offer that. And that's essentially going to be what All One Health uses to confirm that you have access to these benefits. So you want to make sure that you have the correct program name and organization name. The intake person is also going to collect some other information from you, like your name and why you're calling. So if you're like, I want to speak to someone about, my anxiety, I would like to talk to someone right now. And then they're going to say, great, we're going to transfer you to an available counselor. If you're calling because you want to schedule face-to-face counseling, then again, they're going to collect all the information they need for that. And then they'll let you know that they'll follow up with you to get that confirmed. And then I'm going to talk through some other benefits that you can call for support around as well. So I just want to make sure that folks understand that when you call, you're first going to go through that intake process so that they can get you routed to the appropriate person. One of the benefits, and this is available to everyone, is a service called life coaching. So this is kind of taking kind of a different approach where obviously you can access the member assistance program for that in the moment mental health counseling. But if you're looking for some kind of support that is really focused on your professional or personal development, maybe you're really wanting to work towards achieving some specific goals, they can assign a life coach to you. So if say you're really wanting to work on work-life balance, as an example, they would help identify like goals around that and meet with you regularly. So it's a little bit different than mental health counseling, as it's really focused on specific goals that you're trying to achieve either personally or professionally. Another service that's available is legal assistance. So this is an opportunity where when you call the 1-800 number, if you are looking for legal assistance on a specific topic, you can let them know that you're looking to speak with an attorney about a specific issue. So for example, maybe you are wanting help with developing a will, and you could say that you want to speak with someone about that. They're going to connect you with a qualified attorney within that specific topic area. And then you have a free 30-minute consultation. So this person isn't going to be able to probably do everything that you need on that issue, but they're going to be able to provide you with guidance and insights into like what steps you might want to take or where you can get additional resources on that topic. Very similar to the legal assistance is a service called financial assistance. So you can also call and ask to speak with someone around a range of issues related to finances, and you will get connected to a qualified professional. So that may be a certified financial planner, a certified public accountant, a credit counselor, again, for a consultation for free on whatever that issue may be. So an example would be, it's very common within our network. You may have like student loan debt, for example. So maybe you want to call and speak with someone about how you can work to reduce your student loan debt. They're going to connect you with the qualified professional, and they're going to talk through, you'll tell them your situation and kind of figure out a plan or give you some guidance and resources on that subject. So both the legal and financial assistance are really great programs because, again, they're connecting you with folks that are, for lack of a better word, experts in that field and that topic area. And they're going to be able to provide you with some information and resources to guide you around that specific topic area. And then another benefit that's available is called personal assistant. And this is what I would call very much kind of like a referral service. It's very similar to another benefit that I'm going to have mentioned here is called work-life resources. For both personal assistant and the work-life resources, essentially for whatever kind of issue or topic that you're calling for support around, if you're looking for help finding something or a new provider or service, they're going to help you identify what resources are available in your local community. So for example, maybe you're looking for a cleaning service and you want to call them and they're going to help you identify what the options are in your community. For work-life resources, say you're looking for a place to board your dog while you go out of town for a weekend. You could call them and they're going to be able to help identify what options are in your local community. So this can kind of take some of the research out of having or the legwork out, which can be time intensive around a variety of different items, just like day-to-day tasks that you may have to do or things that you're trying to do to help alleviate some of the stress and anxiety around balancing your service with kind of day-to-day life. So again, this is a great resource if you're looking for that support around kind of identifying resources and looking for referrals in your community. And then the last additional benefit is called medical advocacy. So this is one that I always say I think is super helpful, but also one I hope no one has to use, but it's there if you do need it. If you or a loved one is experiencing a healthcare situation, and as we all know, oftentimes that can be somewhat difficult to navigate. Our healthcare system is very challenging to navigate. All One Health, our provider, has expert medical advocates on their staff that can help you kind of walk you through that situation and help you navigate that healthcare and medical situation. So whether that's for you or maybe you are helping a loved one through something and you just want some support through that, you can call and they can help walk you through that, whatever that may look like. So maybe that's understanding insurance coverage on a specific issue. That could be helping to find medical equipment that you need. It could be identifying transportation or appropriate doctors for the care that's needed. Again, one of those things that I hope no one needs, but if you do need it, it is available and a great resource to help navigate a medical situation. So those are kind of all the different benefits that are available through the member assistance program. And then I'm going to talk now about how do you access these services. So I've mentioned the 1-800 number quite a bit. And then we also have a website called My Life Expert. So I'm going to pull up the website here in a moment and kind of walk you through how to access the website. And everyone here can do this themselves right now if you'd like, but basically you go to mylifeexpert.com. And if you are coming to the website for the first time, you're going to be setting up a new account. So first you're going to go to this sign up button on the website. And then you're going to enter the company code, which is AmeriCorps, all lowercase. And then once you enter the code, it's going to ask you for your email. So what email address do you want to use to set up your account? And then you're going to set up a password. So from this point forward, once you've entered your email and a password, you do not have to have the password anymore. You're just going to use, or the code, sorry, you're just going to log in with the email and password that you set up for yourself. So since I already, and again, the password or the code is AmeriCorps, all lowercase. And I'll show that on the screen here again in a moment. So since I already have a login, I'm gonna log in from that home page. And right when you log in to the website, you can see right on that home page here is the 1-800 number. So the nice thing about this website is it's mobile friendly. And if I were on my phone, I would be able to press the 800 number and it would pop up and call on my phone if I wanted to call directly from the website for in the moment 24/7 support. So this is handy to have on your phone. You can save the website as an app if you have a smartphone. So there are instructions that we have on how to do that if that's something that you need support around. So right on the homepage, you can access and call the 1-800 number. And there's also this chat and video button here that pops up. It initially is a bot that's going to ask you what you need support around. It's also going to tell you here, again, if you need to speak with someone immediately, they want you to call that 1-800 number for that in the moment support. However, if you engage with the bot, they'll eventually get you connected to a person that's available, or they may follow up with you to schedule something when someone is available. So encourage folks always to explore this website on their own time, but you'll see that there's a range of resources that may be of interest to you that you want to look at on your own. But there's articles on a variety of topics. So here's an article about burnout, how to manage or avoid burnout. There are a variety of webinars, both recordings as well as scheduled webinars that you can access. So here on upcoming events, you can see some upcoming events that are scheduled. Let's see, there's one on November 9th on LGBTQIA+ sensitivity and inclusion in the workplace. And there's one scheduled for December 7th on time and stress management. So these are some free webinars that are available first come, first basis for members to access and register for, but then they also record those webinars and make them available here on the website later on. So lots of just great information for personal and professional development that we encourage you to explore and see what is of interest to you. So that is the website. Give me a second here to pull the slides back up. And again, here is the website, mylifeexpert.com. The code is AmeriCorps, all lowercase. And we do have instructions, again, for accessing the website, as well as making it an app on your smartphone, if that's of interest to you. I definitely encourage folks to do that so that it's readily available and easy to access. And then we also would encourage you to plug the 1-800 number into your phone as well. So that's just, again, easy for you to access. You don't have to memorize it. It's 800-451-1834 is the toll-free 1-800 number. And again, licensed mental health counselors are available 24/7. It's free and confidential. And we just want to strongly encourage all of you to take advantage of this resource. Again, your AmeriCorps program has enrolled in it to provide these services to all of you, and it is free to you during your term of service. So that is, I know, a pretty quick overview of the benefits that are available in the member assistance program. What I'd like to do now is see what questions all of you have. So if you have any questions, feel free to type them in the chat box, or you can also raise your hand, and I'm happy to address any questions that anyone may have about accessing these benefits through the member assistance program. And I see Monica is helping answer some questions in the chat. So just want to address, we will make the recording and the slides available to everyone afterwards as well. Ashley, for the personal assistance, that is something that you would call the 1-800 number for. So that is not something that you would have via the website or app. So for counseling, for like if an emergency situation, if someone's in crisis, so if you are calling and you're wanting to speak with someone in the moment, because you're in a crisis situation, they're going to connect you with someone right away and kind of assess that situation. if they do deem that there is like an emergency where someone may be in a situation where they may be worried about harm in some way, then they are going to reach out and address that in like reaching out to the local program or contacting local emergency professional in your community. So that is the only situation where they would be reaching out in kind of like an emergency crisis situation. So I hope that addresses your question, but I'm also happy to expand on that if that doesn't address the question. And Elkin, in terms of the question about like household, so all of the benefits that I walked through, again, the face-to-face counseling is the only exception. You have to confirm with your program if they opted into that face-to-face counseling, but all of those benefits that are available to you as a member are also available to your household members. So they access services the same way as all of you. So they would call, provide the name of the program or organization, and they can also access the website and app with the company code. And Sarah, in terms of medical advocacy, you can definitely call and have them kind of walk through and help navigate like a dental medical situation. Of course, you know, the services don't provide dental services, but they can help walk through and help navigate and find kind of dental provider if that's something that you're needing support around or someone is needing support around. And then Lauren, in terms of like a catalog of services offered, the flyers that we've offered and provided to programs does showcase kind of all of the different services that are available. We can send out a couple of those flyers as part of a follow-up from today's call, but your program that enrolled did receive flyers from us outlining all the services to provide to members as well. And the question on different languages. So the short answer is that there is translation services for 140 languages. So a lot of languages are only available in translation, kind of through translation services. That being said, I know that there are counselors that do speak different languages. I don't have right now available a list of what those languages are, but we're happy to ask that question. So if you're looking for support in a specific language and you want to reach out to us at info@statecommissions.org, and I'll put that in the chat, or Monica can put that in the chat again, we can ask to see what language fluencies are currently available with counselors. And Kendra, in terms of how long members have access to these resources, it is during their term of service. There is no age limit in terms of counseling, so it's available to you and your household members regardless of age. What other questions do folks have? I'm sure I've probably missed something, so I apologize, as it is hard to keep up with the chat. And Melanie, there is not a limit on how many times you can utilize the service. So you can call, you could call every day for services. So really it's unlimited. You could call every day, every hour if you wanted to. So as much as you would like to. And then Paul, is there specific COVID-19 counseling available? So we don't have anything that is like unique to COVID-19. However, I'd be curious to know more about kind of what you're asking for or looking for, and we could ask if that's something that's available, and we could explore developing something around that. But we currently don't have something, just for that. That being said, if someone was calling and looking for support and counseling around kind of how they've been impacted by COVID or something that is related to that topic, All One Health would be able to connect them with a counselor around that. Yeah, I see. So concerns about getting vaccines, testing, definitely the referral, like personal assistance, could help in testing services, kind of finding testing options. I definitely think that like the medical advocates would be able to talk to someone about vaccine access, vaccine hesitancy, or questions around vaccinations. So I definitely think that's available, but we currently don't have it like targeted to COVID-19, if that makes sense. And I see a question about like how often, if programs use this last year. So this, that's a really good question. So we get usage reports based on like percentage of the total population that could be accessing these services, what percentage of people access services, and kind of what were they accessing services for. And it seems like a small percentage. So typically what we see is there are some programs that have really high usage rates, and there are some programs that have no usage at all. So it's really program specific. If programs ask us for a usage report, we will provide that to them. So you can email us at info@statecommissions.org and provide a usage report to programs regarding your program. And again, those do not have identifying information. It's like 3 people accessed mental health counseling, or 5 people did medical advocacy. So it's providing kind of aggregate numbers based on different types of services. So we have what we are told is a high usage rate within the industry as a group. But I see that usage varies significantly program to program. And what I always tell people is, we want to encourage folks to make sure their members know that the service is available to them, because we definitely see a connection between those programs that are really encouraging members to access these services and usage. Any other questions? Amy, thanks for asking why the service was created. I shared a little bit at the very beginning that about 5 years ago, we were having lots of conversations in our network about the need for mental health counseling services. A lot of AmeriCorps programs and state service commissions were expressing how hard it was to find affordable and just available mental health counseling services for their members. And so that's what stemmed us basically developing this program, finding All One Health as a provider. And then we piloted the program the first time about 5 years ago, and took off the pilot name after that first year, as we got really positive feedback from our network that this service was really helpful in providing services that otherwise were not available or were hard to access for some programs in their communities. And Paul, yeah, we can definitely resend the flyers and those materials. If you want to reach out to Monica at mgreenfield@statecommissions.org, we can get those resent. Thanks, Amy. It's great to hear that you are using the service. I love to hear that. And again, just want to encourage folks to use the service as much as you'd like to. I mean, it's really for you. And what I want to encourage people to do is like use it regularly. I want people to use it if they, need that support in the moment. But I want people to feel like they don't have to be in you don't have to be in a crisis, or you don't have to be like dealing with a situation to reach out to talk to someone. You can just reach out to reach out on whatever the issue may be. So encourage you to access it regularly. And here is the 1-800 number again. It is 800-451-1834. And Alexa, you can find out if your organization has the face-to-face counseling. You should be able to ask your program director, but you can also reach out to us at info@statecommissions.org. And Susan, so there isn't like an app that you would search for on like the App Store, for example, for this, but essentially the website can be saved as an app on your smartphone or your smart device. And so it is a mobile friendly website, and you can save that as an app icon on your phone. Any other questions? Well, what we will do as a follow-up, and I'll stay on for any other questions that folks have here, is after this call, we will send out a message to everyone that registered with a copy of the slides from this, link to the recording if you want to listen back to the recording. I'll also attach some of the flyers that we provided programs as well, so you have those easily accessible to access all of this information and the flyers as well. Alexia, so we do not provide insurance. So this is not an insurance program. It's not health insurance or dental insurance. So I would talk to your program about if your program is providing health or dental, but that's not this program. This is our mental health counseling service. So if you do need help navigating like a healthcare situation, which could include a dental situation, then you could definitely call and speak to one of the medical advocates of our program. And then the question about how many sessions you have with a life coach, there currently isn't a set number. So it's really situational. So if you, depending on the goal that you're setting, they're going to work with you on kind of frequency and how often you're going to meet with that life coach. Any other questions? This is the only informational webinar we've had. This is the third one that we've had, but they're all the same. So all of the informational webinars on this service are the same. We don't have any other informational webinars scheduled, but we're very open to hosting more if that's helpful to folks. Something that we've done in the past is that we have offered special webinar training topics for either AmeriCorps program supervisors in the member assistance program or for members themselves. So very open to facilitating things like that again this program year. So if folks have specific topics of webinars that would be of interest to any of you, we would entertain those suggestions of topics if you want to offer them now, or you could follow up with those suggestions via email as well. And that's correct. The services are available to you during your term of service, so they do end when you complete your term. Any other questions? All right, well, I again will stay on here a couple minutes to see what other questions folks have, but I just want to thank everyone for joining us today. I want to also thank all of you for your service. Really appreciate all that you're doing and serving your local community through AmeriCorps. If you have any questions, again, please don't hesitate to reach out to us. The best way to reach out is via our info@statecommissions.org email, and someone on our team will get back to you as soon as possible. You can also, again, always call that 1-800 number for any questions on what services are as well. And I see that question. If you have a household member, in this case, if it's a family member that wants to access services, they're going to access services the same way that you do. They're going to call the 1-800 number or use the app. And when they call the 1-800 number, they would need to know the name of your organization or program, just like you would provide when you call for services. And then I have a question that's come in about like how you would report this, I think to HR is the question, and how that would maybe affect other benefits. But again, our service, this is not a healthcare program. It's not health insurance, I mean. So our accessing our services, the member assistance program, shouldn't impact access to any other benefits or services that are available to you. But if you have more questions on that, definitely let me know. Yes, I don't think that accessing the member assistance program should have any impact on other benefits that you might be accessing, whether that's like SNAP benefits, any other kind of public assistance. If you want to reach out to me and talk about that further, I'm happy to do that. At the moment, I'm not aware of this impacting any of those types of benefits. And Jack, so the company code is the same for everybody. It's AmeriCorps, and it's all lowercase for the My Life Expert website. And I'll put that up here on the screen as well. Any other questions? All right, well, please do not hesitate to reach out to us at American Service Commissions if we can answer any further questions. We will follow up with the resources that I mentioned. And again, thank you all. I hope you have a wonderful rest of your week. Bye, everyone.